Hi everyone, I'm Sandra. Ben and I started these videos a few months ago to bring awareness to addiction and mental health. Yesterday was Black Balloon Day. Black Balloon Day was started 4 years ago by a mom who lost her daughter from an opioid overdose. And so there was a lot on support groups that I'm on, just having pictures of their child that they've lost or a loved one that they lost with a black balloon, and just remembering those people. So while reading through and reading other people's stories, I was thinking, wow, that's so sad. And it's great that this mom has wanted to bring awareness to addiction, and she's doing it. Again, this is the 4th year. And while I'm reading and reading up about Black Balloon Day, I did some research myself. And I was shocked at what I discovered. Some of the numbers that I found. In 2017, there was almost 4,000 deaths due to overdose. That's 3,987 deaths in 2017. That's 11 per day. 11 people dying of overdose. The latest stats I found was the first half of 2018. There was over 2,000 deaths. Just the first half, 2,066. And I read somewhere there was nearly 4,000 in 1 year. And I'm going to guess that was 2018. It's hard to find updated stats. I had a hard time. Maybe it's my searching, but that's staggering. 4,000 deaths in 1 year due to overdose. So I took it another step further and looking at the mental health part of it, and I discovered that there are approximately 6,000 suicides annually. This is in Canada. These stats that I'm giving you are Canadian for the country. 6,000 suicides. And where I got that stat was on Stats Canada, and it's slightly below the number of deaths due to cancers of the colon and the breast. So, you know, there are tons of fundraisers for all these diseases, which I think is fantastic, because we know that our health system is burdened by a number of diseases, and I don't want this to be a fight against diseases. They all need help. They all need funding. One of the good things is the Narcan kits that they are giving out so that you could save a life due to an opioid addiction, mainly fentanyl. I just wanted to share those stats with you because I find it just, it's mind-boggling, the numbers. I was comparing it to SARS. If anybody remembers, in 2003, there was a big epidemic of SARS, and it was huge, and they did fundraising, and the hospitals were very cautious. You couldn't visit patients in hospitals. You needed to wear a mask. It was a good thing because they wanted to stop the epidemic from spreading, and they did a good job. But I guess I see that as a huge impact. And I was looking at stats for that, and this is in Canada. There was 438 probable cases and 44 deaths. I was a bit surprised because I guess I expected more deaths. I know that sounds horrible, but when you compare this epidemic of SARS, 44 deaths, to the crisis we have here in Canada and all over the world, because I've chatted with people from all over the world that are in the same situation as myself with an addict child or loved one, and it's just mind-boggling. And I guess my question is, what can we do about this? I was watching a video of the health minister from a couple of years ago, and she says, you know, there's not a lot they can do, or they are doing safe injection sites, which is good. I don't know, I think there needs to be more. I think if people knew the numbers, that maybe more attention would be brought to it. Unfortunately, what I see is that there's such a stigma to addiction, and people don't talk about it the same way as if they had another disease, and the support isn't the same. I'm here to tell you that addiction does not discriminate. There are people from all walks of life. It's not just those people that you see living on the streets, you know, asking for money. People are people. We are all human beings, and everybody deserves to live, and everybody deserves to have help. I know from my experience with Ben over the years, it's not easy to get help. It's been a challenge. Ben's going to be 22 this month, and this started when he was 14. And it's been this last year that I've seen progress. And yes, he still has been out of the hospital, and he is still clean of opioids, but he still has a long journey ahead of him for recovery, and he does have support groups. But it was years in the making, and I see what we went through when he was being hospitalized so many times, and it's like he would overdose, he would flatline. And it wouldn't be once, twice, 3 times. I mean, it was tens of times, you know. Why aren't they doing something there? I know that there's such a burden on hospitals for mental illness and addiction. And I think it's great that they're opening up safe sites for people with addiction. It's great because they have a safe place to go, and there are resources there. It's not a party. Like, I don't know what people's impressions are, but it is a good thing, and there are studies that prove that they have saved many, many lives. I still have my Narcan in my glove compartment because you just never know, and that's a good thing that's also happened. Our health system is broken. We need to fix it. I'm not sure what we can do about it. I'm here to raise awareness. I'm here to share my experiences, and I'm here to help if people need it. The sad thing is that people that are affected by addiction, a lot of people keep it to themselves because of the stigma. They don't want people to know what they're going through, and it makes me so sad, because when you're going through something like that, that's when you need the support. That's when you need your friends. That's when you need your family. So I urge people that are in that situation to reach out to one person that you can trust. You'd be surprised. Like I said in a previous video, the more I talk about it, the more I hear about other people going through similar situations, or someone that they know that are going through addiction. Anyway, I just wanted to bring that awareness to you. The numbers are staggering. I wish that I could do more. I'm not sure. Maybe there is. Maybe you can comment. I think it's important that we take the stigma off so that people talk about it more. Right now, Ben is an addiction survivor. Yay. And we're just going to continue moving forward and continue raising awareness. And yeah, that's it for now. Anyway, that was the mouthful. I know that I hope I said the stats correctly. I was researching. I was trying to find the most accurate numbers. Anyway, I wish you guys all a great day. Thank you for supporting. Thank you for subscribing, sharing, commenting. Be safe, be smart, and remember, where there is breath, there is hope. Yes, there is. Anyway, have a great day. Peace. Cheers.